After completing his training and becoming board certified family physician, he opened Atlas MD, a practice that he'd been dreaming about for nearly a decade. Now he is able to shrug off the burden and restrictions of government and insurance regulation so he can focus on his patients. What a novel idea. As a pioneer of direct primary care, he is a national leader in this innovative concept that restores the doctor-patient relationship while reducing cost, increasing transparency. Please welcome the good doctor here to the Palmetto Panel.
Thank you very much for that introduction and for having me here today. Before I get started, we have a couple direct care doctors from the state of South Carolina in the room with us today. Can I ask them to stand up? Excellent. You get to listen to me for the next 30 minutes, but you want to talk to them when this is over, right? Collectively, our goal is to make most healthcare too cheap to insure. And I think most people fall into this rhythm of hearing solutions for complex things, but not really expecting the government to come along and fix it. It's one of those big, hairy, complicated problems. You hope they do, but the proposal is always for maybe we'll fix it in 5 to 10 years. These physicians are fixing it right now. And that's the benefit of direct care. It's a shovel-ready product. It's been around for 15 years. This isn't theory, this is practice, right? Now, it wasn't easy, but we didn't start fixing healthcare because we thought it would be easy, or because it was, it's because we thought it would be, right? Everybody wants cheaper healthcare, but the process to get there is interesting. Growing up, my dad was a trash man. He's a lawyer now, so I still tell people he's a trash man. Much less embarrassing. Now he's my lawyer, but not a criminal lawyer, just a corporate lawyer. I think the more lawyers you end up hiring in your life is a metric for how successful you're going to be, as long as they aren't criminal lawyers. And so, but growing up, it was a great business, right? You paid once a month, we picked up once a week. It just worked. So then, as I started working for a surgeon in undergrad as a biller and coder in 2000, I saw this sausage getting made and said, this makes no sense, right? It wasn't a system designed for the physician to win. It was designed against them in all regards. Sure, you'll do the work first, and your professional ethics will make sure you do the best work you can for your patient, but after the fact, you have to build and code and add a modifier, and we'll challenge you with somebody who's not medical and kick this paperwork back to you. And so the real trick was not being good at medicine, but being good at paperwork, right? And we didn't go to med school to be good at paperwork. That's what AI is for. And so, but we knew there had to be a better way. And I kind of think there's this Emperor's New Clothes aspect to that. If you're familiar with the analogy, the child at the end of the story is the wise fool who points up and says, the emperor's naked, right? But doctors are very, much in the system after years of education, and it's so big it's hard for them to say, where's my role in fixing this as well? We know it's broken, we know the Emperor's New Clothes don't exist, but it seems too hard to fix. But we said there just had to be a better way, and we watched insurance-free movements grow from 2000 until we opened in 2010. And the dream was always to make something that was affordable for the masses, both patients and physicians. And what we realized was we could combine the best of different business models to get what we were dreaming for. And that was direct primary care, or direct care, which is an insurance-free model for family medicine or specialty care. In the same way, we don't have car insurance for gasoline or windshield wipers, and we don't have home insurance for lawn care, and we don't have life insurance for food. Why do we have health insurance for family medicine, for meds, for labs? We've fallen into this assumption that all of those things are expensive, right? And it's a self-fulfilling prophecy. You go to the pharmacy, you get a high bill, you see your insurance bring that down to your copay, so you assume that's the reality that exists. right? But, it's the thinking that got us here isn't the thinking that'll get us there. Much in the same way a restaurant doesn't buy food at the grocery store and then sell it to you, they have a wholesale market. And we learned that in a variety of ways. But if you go direct to the manufacturer for the medications, you can get them for 95% less. In some cases, against Walgreens for seizure medicines, we're 99% less. That's too good to be true, and pardon my French in the South, I'm from Kansas. We're not in Kansas anymore. You should wave the bullshit flag, right? That should sound too good to be true. We understand a phone is a great product, but if you try to sell me the new iPhone for $10, of course I'm going to be skeptical. But I think that's the right sizing of showing people this is how broken it is. It's just more broken than you expected. But the solution is that easy too. So I'd like to talk about two stories, fables. Christopher Columbus, he discovers the new world. He comes back home. All the king's horses and all the king's men say, well, you're not that smart. We already kind of thought the world was round. You proved it. Thanks. Good job. So he takes an egg. He challenges all the king's horses and all the king's men to make this egg stand up. And of course, as you can imagine, an egg won't stand up. It's designed to wobble. And so they all agree it's impossible. So he takes the egg, he crunches the bottom, egg stands up. Right? We get stuck in this process of thinking in the same way. I didn't say you couldn't do anything to the egg. I didn't say you couldn't change how we deliver health care. We kept trying to fix it through insurance. We kept trying to do the same thing, the new thing, in the same old broken way, and we're shocked that we didn't get good results. As physicians, we tend to be very data-driven. If you have an infection on your leg and I'm giving you antibiotics and each day it grows, then I'm going to say that antibiotic isn't working. If we keep trying to fix healthcare and it gets more expensive every year, the fix isn't working, right? The other story is Napoleon's aluminum. Aluminum was so rare that when Napoleon wanted to impress dignitaries, generals ate off silver, he ate off gold, and the dignitaries ate off aluminum. Fast forward with the technology, we have aluminum foil we throw away. Not that we want to make healthcare throwawayable, but we do want to make it so affordable everyone has access to it, right? Capitalism brings the comforts of kings to commoners. Everybody should be able to afford good health care. The problem is we keep trying to make everybody afford good health insurance first and then buy health care second, right? It's a very dumb doctory way to solve a problem. No offense, doctors. Not these doctors, they're brilliant, they're doing direct care. It's looking at the problem and saying, in my experience, the patients who have the best insurance are the easiest to take care of, I get paid the most for the work I do, etc. Make everybody have great health insurance. But that's a very backwards way of solving a problem. The smarter way, the scalpel way, is to say, how do we make healthcare so cheap we don't need insurance? But after decades of trying to explain to everybody that you're in a good job if you have good insurance, right? It's a tough mental game to switch. For example, you're not supposed to buy the on-sale engagement diamond. I did. You're just not supposed to, right? People judge health insurance, ergo health care, by is it expensive enough, or is it a brand I know, or is my copay small? Because we've made it so hard to be a good consumer of health insurance that we break it down into those knowable things. And we want to kind of explode that process and say, look, it should be like a gym membership. And so that's what we have, $10 a month for kids, $50 a month for most adults, for unlimited home visits, work visits, office visits, all the free telemedicine you can have, calling, texting, emailing, video calls. We have no need for copays. We've eliminated copays, right? Netflix beat Blockbuster by getting rid of late fees. And Blockbuster didn't want to get rid of late fees because they made $800 million a year on late fees. Insurance requires a doctor to do a copay because they want a speed bump so that you spend your money before you spend their money, and it makes you just think about it, right? We want you to get as much health care as you want. We don't want a speed bump. And financially, we don't need it. So it's best of all worlds. You get more care more often for less money, and we're still sustainable. Then it's a race to see how much value can you add, right? What have we done for you lately? What else can we fix? Partly because I like to work, but I'm sort of lazy on stupid stuff, right? I don't want to fill out insurance paperwork for your blood work. I just want to order a lot of blood work to see what I can see, right? If I have to justify your thyroid work, I'm spending more time on your paperwork than on your patient care. That's a broken system. You don't want that, right? You want teachers teaching. You want trashmen picking up trash. You want lawyers quitting. And so you do the work that matters, and I think that's the problem, is we kept assuming the paperwork helped, right? Elon Musk likes to say the most common mistake from an intelligent engineer is optimizing a system or a step that shouldn't exist, right? What you're seeing now, I love AI for AI's sake, but it's a tool. And what you saw was insurance use AI to streamline their workflow of telling doctors no. So doctors are getting AI to streamline their workflow of upcoding your bill, and now they're fighting against each other with more AI, and it's not helping you. In fact, it's making it worse, because the more the doctor can squeeze out of your insurance company, the more your premiums go up every year. So it's this sort of slow, feed ourselves poison where, well, the doctor needs to make money, right? They need to be sustainable so that they'll be around for you, but we're contributing to the problem of increasing health insurance and increasing premiums, and that means less care. So we got to kind of skip past that. It's not AI to optimize steps that shouldn't exist. It's cut those steps out completely. This is designed by subtraction, right? This is why the iPhone works so well, is it removes barriers. And you shouldn't need $1,500 a month health insurance premiums to be able to treat your diabetes, because it costs me $3 to check your A1C, and I can get metformin for a penny a pill, or thereabouts. 1.3 cents per pill. We mark it up 10%, because we're dirty capitalists. So it's almost 1.5 cents per pill by the time I'm done with it. So you can get a year's worth of medicine for $15. Why are we insuring this? Why do we keep making the same mistake? The momentum of the status quo, fear, right? We don't want to be caught without health insurance, because in our heart, we know it's not health insurance. We know it's financial insurance. I'm just terrified of a big bill. Healthcare is broken. I can barely get my doctor on the phone, let alone figure out what happens if I get a big scary bill. Fine, the devil I know in my monthly premiums is better than the devil I don't know in a crazy bill in the future, right? But it doesn't have to be that way. What I find amazing, I do these talks, I do podcasts or interviews, and usually at some point it comes up, this is too good to be true. I know you're all thinking it. You don't have to say it. I said, no, my car drove me to work yesterday. That's too good to be true. We have billionaires racing to space. That's too good to be true. I have 3 supercomputers on my body right now, a watch, phone, and AirPods, right? That's amazing tech. The fact affordable health care is just basic algebra, right? It's not even calculus. This is just simple math. Bring the cost of everything down as far as you can and make it as affordable as you can, and then let the market take over from there. So if we can cut out meds, which is 30% of your health insurance, and labs at another 10 or 15%, and copays, which are another 30%, you start to realize that actually most of us don't use that much health insurance in a given year. Walmart has a $4 a month list, right? And they've had that for 20 years. They haven't done anything interesting in healthcare since then. To that point, one of our direct care doctors in Georgia was the chief medical officer for Walmart and quit because he said they'll never get it right, and started his own practice, brilliantly named Stand Up Direct Care because he's a comedian. Better doctor than he is a comedian, but that's what you want. Laughter's the best medicine, but actually medicine can be pretty good medicine too. And so I think that's really interesting when you have people at that level looking at what's trying to be fixed in that way and say, that's just never going to work. Let's come back here. Walmart uniquely invited us out April 2012 to talk to their executives. Turns out you're not supposed to insult Walmart executives to their face. I know that now, okay? They haven't let me do it since. But we have a $4 a year list, right? And if groups of individual or small practices are out competing Walmart, then you know you have a broken system. Because direct care doctors are putting patients first. We are saying we're on the front lines of this, we're at the bedside, we're looking at you and your family, and we say, how do I get you the best care possible so I can practice the best medicine in my life, right? It's easier if I can order more tests. I had a VIP join once, and he asked, are you a good doctor? Which is a fair question. And I said, no. And so he smiled, and all right, because either you get to say you graduated from Harvard, top of your class, or you got to come up with a better answer. So instead of graduating from Harvard, I became funny. So I said, well, I did graduate at the top of my class. Top of the bell curve. Slightly to the left if you're good with bell curves. And so you don't have to be the best doctor. In fact, the best doctor that you can't access is no good to you, right? Yeah, you have to be a crazy good doctor to get your entire medical history in 7 minutes, make the diagnosis, explain the medicine, order the labs, make you feel heard, and document it. That's tough, right? Getting an hour to spend with my patient, to let them tell me the whole story and build trust and navigate between sports and kids and pets and healthcare and have the spouse tell on the other spouse, which is wonderful. Usually it's the wife telling on the husband. It makes it easy to be a good doctor, right? If I have $100 to order labs and I can only order one test, I'm not a good enough doctor to figure out what's wrong with you with one test. When they're $2 each, now I don't have to be a good doctor, right? There's a great book, Anti-Fragile, right? A good system is not only, if you look at fragile as easily broken by stress, the common mistake is to say the opposite of fragile is strong. But that's just the middle ground. The true opposite of fragile is strengthened by stress. Muscles, bones, things like that, right? So you want a system that gets better with the more stress it has. The sicker you are, the more labs I want to order. The fact that I can order and do more means I can save you money and figure out what's wrong with you. And we have cheaper meds, so we can experiment with those meds. Sometimes it's cheaper to say, do you have myasthenia gravis? I don't know, it's an expensive test, but I know the meds are cheap, maybe we start there, right? Because if the meds for it work, then I bet you have it. And other scenarios like that. But the real goal of that is, it's this love story between family medicine and business. I think there's this cliche Hollywood line of, it's nothing personal, it's just business. But growing up in a small business household, there's nothing more personal than that, right? You're feeding my family, and in exchange, I'm caring for the health and well-being of yours. I don't want any friction point between that, let alone insurance. If that's the rate-limiting step, let's cut that cancer out. Let's use it just when we need to. A wrench makes a pretty decent hammer, but a hammer makes a horrible wrench. We want health insurance. It has its role. It's an excellent role for the things insurance is good for, right? I make this joke frequently because people ask me, what do you think about this medicine or that medicine? And they're usually shocked that I'm very pro-medicine. They say, well, what about diet and exercise? I said, good question. I said, I can't diet and exercise my hair back, right? Diet and exercise is great, but not great for everything. Insurance is going to be wonderful when you get to the hospital and you have a big bill, because you rarely go, and that's what you want to be covered for. But you shouldn't be paying more than your mortgage every month to be covered for something that happens so infrequently. We should right-size that. I don't give you all the antibiotics I can, I right-size it. The dose makes the poison. So the right amount of medicine treats the right disease, the right amount of insurance treats the right problem. Again, financial insurance. Now I think we can have our cake and eat it too, which is maybe the too good to be true part of, I can have unlimited 24/7 coverage with my doctor's cell phone and email at an affordable price, right? But I can also match that with health insurance that covers what I need but saves me a lot of money, and then I can have my own money. I can give employees a raise. Employees can choose what to do with that money. They can pay off bills or invest in their kids' college or anything, right? But right now, health insurance is sucking the oxygen out of the room and is a net drain on people's life. And if I blame anyone, I blame doctors not present, right? Is we're complicit in a system that's actively hurting you by sort of just being bricks in a wall. It's easier to get along than to rock the boat, but also we were never taught business, and we're not sure. We're risk adverse. This is scary. There's a lot of change here. If I build it, will they come, right? But so far, after 15 years of building it, yeah, right? We started off with a handful of clinics like this in the country in 2010, and now there's thousands. It took, for reference, Starbucks 16 years to get 17 stores. And we're doing a lot more than selling coffee, right? But so it happens. It's a grassroots movement. I actually think patients get it easier than doctors because they hear, all right, I want healthcare. I don't want to wait on hold. I do want it faster, easier, better. But I also don't want to pay more for it because everything costs more. But then doctors hear red tape and regulation and insurance and credentialing and et cetera. So it's easier to talk to, I think, patients and say, you know what you want when you see it, right? But if we asked you, it might be hard for you to build that. You're not a doctor. You're not supposed to create their business model. You don't know that there's wholesale meds and wholesale labs and discounts for everything, right? But you know you want a better product. I don't tell Apple how to build a phone, but I appreciate every time it gets better. And I think that's the direction we're heading in, is patients are getting so frustrated and they're hearing about solutions through talks like this or podcasts or whatnot, that they're going back to their doctors and they're saying, this sounds great. Will you do this? Will you start a practice similar to that? Or employers are saying to their employees, can I provide you something better? Maybe, not everyone goes to the gym, not everybody, likes the same kind of food, but if you need a lot of care and you finally have a doctor sit down, spend 90 minutes with you, and it doesn't cost extra, for a lot of people that's, really important. But just that also ability, I'm not a car guy. I have to pay a mechanic to fix my car. My co-founder, Dr. Doug, he's a gearhead. If it's, got an engine, he knows about it. So he can fix his own car most of the time. And I use that analogy as an example of if my kids fall and hurt themselves, I tell them, good luck. Like any good ER doctor, I made my son walk around for a day and a half with a broken arm because I didn't think it was broken. But I'm not worried about it, right? If it ends up being broken, I know what to do, or I can stitch them up, or I can take care of it. But there's so much medical anxiety out there for families. They feel they're always just a heartbeat away from an ER visit and a giant bill that makes no sense and a debt that follows them for years. So understandably, they fear that. And the too good to be true part should be there of how can stitches cost $1,000 in the ER but be free in my clinic? Well, free because it's great marketing. In part because I swear every Halloween I end up sewing up somebody who tripped on their costume and comes in dressed as whatever and needs stitches, and I think that's awesome. And then they tell their friends and family, and free, oh my God, the power of free, right? Free and trust is not only was it fast, it saved us an ER visit. You were there to help. The Mr. Rogers line of look for the helpers. There's a reason physicians have lost trust in the community. COVID among others, but just that general, I can't talk to my doctor. They hide behind a white coat and staff and phones and insurance, and all I want to do is have a real conversation. And if no one is out there showing me, what I want to hear, then I just distrust the whole system. But if someone is saying, no, sit down, just talk until you're done, right? What's that cost? I'll tell you exactly what that costs. How can it be so cheap? Mostly because we smuggle drugs across the border, but it's very reliable supply chain. I don't see Trump changing that anytime soon. No, but it's just that simple. Again, it's just the manufacturers. It's the same way pharmacies do it. It's the same way everyone's done it. At some level, you should almost be upset that the solution has been that close for this long, for forever, right? We didn't create these solutions. We just realized that we could apply them. And that's the goal, to be able to be as good at the business side of helping patients. Because if I save you $1,000 a month, I'm helping you just as much as if I treat your anxiety or your depression, right? But now, I think there's this hesitancy to be on medicine because, well, I just don't know what that'll cost. What will that do to my insurance? Do I have to be on it forever? And besides not getting those questions answered, if you do see it's a big bill, hey, look, I don't feel my cholesterol. I'll wait till later. Johnny needs a new mitt. It's summer, it's vacation, it's whatever. I can use that money somewhere else. It changes the whole thought process, though, and you're like, oh, it's $3 to check my cholesterol? Oh, it's 2 cents a day to treat my cholesterol? Yeah, throw that into you, right? And then that leads to better outcomes down the road and healthier people. So not everything has to be a medical problem. We balloon that up because the bigger the problem, the more we can bill your insurance for it. But if we minimize that, if we design by subtraction, bring this down to real things, we make the whole system better. And I think that's the goal. Is these physicians here have really put life and limb on the line to leave a broken system that will pay them very well. It may burn them out. It's not good for you, but they said it's harder for them to go into this model, but it's better for the patient. It's worth it, right? When I talk to my med students, I say, if we take our Hippocratic oath seriously, it should mean do no harm. And that means do no financial harm, right? Do no harm of lack of treatment. Because if I didn't tell you that your treatment was pennies a day away, then you're going to suffer longer than you need to, right? So many people just don't treat their kids' anxiety or depression because they just need an hour of time to talk with the doc to understand what's going on. Or to go through several hours of that for, okay, well, I don't want to start with meds and I do want to work our way through, but I want you to be available for the conversation and I shouldn't have to pay hundreds of dollars every time I need your hour. Right? Because then that feels like the doctor and the patient are on opposite ends. I'll only help when you pay. So the membership model, this just says, nope, come in. It's an all-you-can-eat buffet. Most months you don't need it, but when you do, right? I had a patient with a spider bite. I saw him every day for a month. It might be by video call. It might be by text or email picture or in the office occasionally. But it was reassuring to them and to me, right? And to my malpractice company. Which is funny because upset people sue, right? Malcolm Gladwell had a great book, Blink, and they could predict which surgeons, any surgeons in the room? Great. They can predict which surgeons will get sued just by the tone of their voice, not even the words they said, because happy patients, even if something goes wrong, are less likely to sue because they at least thought you tried to do your best, right? But if you don't like your doctor, you don't feel they're doing their best, they don't feel a connection, if it goes wrong, you're understandably upset. The best way to prevent lawsuits is to make happy patients. The ironic thing about that is the best way to get great outcomes is to get happy patients, right? Is to show how we are connecting with patients and be on the same side of this. And, it doesn't have to, it's a team approach. I always say, my patient knows the experience of their body, but I know the medicine, or at least I'm trying to, right? And that's the big difference. Come together as a team, take the time, lower the resources, change these barriers, and then see what kind of good we can do. And these doctors want to help your families, your employees. They want your business to be more profitable and thrive. They're small businesses too. I don't think there's a clinic bigger than 4 or 5 docs probably in the area, right? So these are small businesses, for your community. And that's what I love about this. They're leaving the safety of these giant Fortune 500 companies to come out and say, no, there's a better way, and I want to be a part of that change and that solution. So it's an exciting time to be a doctor. Hopefully it's an exciting time to be a patient. And I think we're really going to show that we can fix healthcare in a major way through the model of direct primary care. All right. Thank you very much.